I'm ready.
Good afternoon, Dr. Spiro. I was going to say good morning, but it is Eastern time, at least 12:01.
Yep.
So you and I are here for Trust the Process for December 2021. Is that right? Yes.
Yep.
We were supposed to do this last month. We weren't able to. There have been so many complications, me with COVID and all kinds of stuff that have happened. So your schedule. So now we're going to talk about what we would have talked about last month, which is issues that affect people who immigrate and how those issues can be discussed in counseling. So I think what we may do, unless somebody joins, and if somebody joins, that's great, talk about our own immigration experiences, things that people can think about in counseling, and just kind of have a conversation about this that might be beneficial for people to consider as they work through the program. And maybe your students might be interested in doing the same. You can share the video. All right. So I'm going to let you start. Go ahead and introduce yourself.
Okay. So hello, I'm Dr. Ljubica Spiro, and I am a counselor educator and have been since 2006. I've been providing clinical services to various clinical populations, and in particular specialized in working with immigrants for a while in college settings and medical settings. Since 2003, so quite a bit of time. So that's who I am. Thank you.
And I am still Tiffany Rush Wilson. I'm the Associate Department Chair here at the Chicago School. And let's see, I've been a licensed counselor since 1998, and then counselor educator since 2003. And I've done a lot of stuff with diversity and multiculturalism, like racial and ethnic equality. But then in what year was it? 2006, I moved out of the US to Canada. And I've heard people say like just Canada, but it is a separate nation with its own culture, its own norms. And then in 2016 became a Canadian. So I am an American citizen, I am a Canadian citizen, and must carry 2 passports around with me a lot of the time because, I'll talk about that a little bit more, but in order for me to get into my country, whichever one it is, I must use that country's passport. Who knew? I didn't even know that. So,
right.
until I found out at customs. So, all right. So an immigration story. Tell me a little bit about, or tell us a little bit about your immigration story.
So my family came to the United States 1980. My father was here before 1980 because he had to file for our paperwork for my mother and myself and my brother. So I came here as a young child in 1980. Lived on the East Coast where there was a huge Macedonian, that's my ethnic identity, a huge Macedonian population. Many immigrants will come to this country and find themselves living within their communities that have already been established near churches. And that's how folks oftentimes stay together as, little enclaves, ethnic enclaves, and continue to support each other. So I've been in the States, like I said, since 1980, lived in New Jersey, and then we moved to Ohio. Big culture shock for someone from the East Coast anyways, but for an immigrant in particular, because you just don't know if you're going to have the connections that you had on the East Coast. We did. And interestingly enough, immigrants, Macedonians, I should say, tend to move again where there are churches, Eastern Orthodox churches. So that's how we ended up in Ohio. And I've been in Ohio for many, many years, moved to Atlanta for some time and came back here. So I've lived multiple places. Believe it or not, there were no Macedonians except for myself in the Atlanta area. So you can see, I was the only one on the US Census. It was kind of funny. Oh, there was one other guy, he did a Chick-fil-A commercial. Who would have knew, right? And we laughed about that when the census worker came to my house. But we're a very small group of people. There's only 2 million Macedonians in our country. Most of us are expats. Living in North America, Australia. We're on every continent, but the majority North America, Australia. Where our larger communities are at. So would you like me to say anything else?
That's actually quite interesting. So, You know, actually, I have a couple of questions I'll follow
Sure.
up with you on when I talk about my own story. So I was born, I'm in Ohio right now, in the US, in Ohio, in the same state where we are both sitting right now in just separate counties. And the diversity issue that I faced was always related to being a Black American and that balance between being an American and then the differences of being a Black American. So it was all domestic stuff. And then, as I said, in 2006, we moved to Canada. So then I was an immigrant. I was on the equivalent of an American green card. So I had a permanent residence card. And that was kind of interesting to not be a citizen and have to kind of watch certain things. Like, for instance, you and I once spoke about that one day when we realized I needed to go back to the States because, you know, Toronto to Cleveland is 4 hours. So I'm able to come back pretty often, which is a luxury. It's a privilege. But when your immigration paperwork is not in order, they don't have to let you back in. So I'm thinking, my child goes to school there, my family, I'm living in Canada. Will they let me back in? Because they really didn't have to. And that the particular immigration officer who stopped me at the border coming back in caught it and said, you know, I had to go inside because driving across the border, they have the little kiosk there and the person can let you in. We got flagged. We had to go inside, had to be talked to. It was really interesting. And she said, for you, for this, because it's summer and because you've already filed for your paperwork to be done and it just hasn't yet been approved, I'm going to let you in as an American visitor, but take care of the stuff because we will not let you in again. That's scary.
Oh, absolutely. You made me think of something. I didn't become a US citizen until 2009, but I've been here since 1980. So I had a green card all those years. And when you have a green card, what people don't realize is they need to be renewed every, I think in the States, it's every 11 years. And you have to go through this process of gathering paperwork and answering questions. And a green card holder in the United States has the same privileges as a US citizen and is required to do many of the same things, pay taxes and things like that, but you can't vote.
Right.
You can't vote and you can't run for office. So yeah, I was older when I got my citizenship. So you made me think about that. That's a whole nother process you have to think about when working with immigrants. You have to know their status. Are they here on a visa? Are they here on a green card? Do they have citizenship? Lots of implications. But I think that's a really, just made me think of that. And I thought I'd share it.
Yeah. And ethically, what do I do when I find out I have this DACA kid who is no longer a kid and whose status has expired, but they don't want to go back to the country of origin, which is something that I did have to face in practice, where the mother had citizenship, but the child actually did not. And that was challenging because a parent is not going to go, oh, I'm just going to go back to this place that I left for the reasons that I left because my child needs to go back, but my child is now here illegally. What am I supposed to do? Those things are huge. Those are powerful. Another story that I was telling you is something else we need to think about, making sure I'm following my list here, is when I became a permanent resident, it was really a matter of filling out paperwork. And to become a Canadian permanent resident, I've heard and I've had other people tell me they did it from their country of origin. We did ours from Canada. We did it at the border. That was something you could do. But to become a citizen, it was a very different process. And one of the things I didn't expect was that there were medical evaluations involved. And it really did feel for me in some ways like when I go to the grocery store, which I don't do a lot now since the pandemic, I get a lot of Instacart. But when I was going to the grocery store, if I wanted oranges, or tomatoes, I have to feel the tomato before I'll purchase it. And being in this medical situation where I'm being evaluated medically, which I do understand, it still felt like, you know, somebody was squeezing to see if I was the right tomato. And there was one point where in the exam room, while I'm gowned, this physician who was not my doctor. So it wasn't like I got to go to my doctor in Canada or even my doctor in the States. I had to go to one of these doctors who was approved by immigration, essentially, citizenship and immigration. And he had to document how many tattoos I have. I have any tattoos, how many piercings I have. So my ears or like my navel or those types of things. And they had to like document it. It was like he was taking inventory on my body. It was really interesting. My height, my weight, it was very odd. And then after that, was it an x-ray? There was something more invasive that I was surprised they had to do because they had to take out my earrings. And So it was just very interesting to be poked and prodded that way and evaluated. And I was very uncomfortable with some pieces of it, but understood what was happening. You know, I am asking another country to allow me to be a citizen of that nation permanently. So that was interesting for me. And in that same exam, when I'm in the waiting room, you and I talked about this right before the recording started, there was a woman who looked like she might have been in her early 50s or so, but she didn't speak any English at all. So it allowed me to kind of think about the privilege that I have as an English speaking person immigrating to Canada, as a French speaking person immigrating to Canada. These are languages that are spoken in this country. They're two official languages. I don't have a language barrier, but we did have to have an assessment for language. We had to have medical assessments, all these things to see if we were, I guess, fit. Our educational attainment, all kinds of things were evaluated. But this woman who I started to reference, and they wanted to know if she could possibly be pregnant, which was a question they asked anybody who was native female. And they couldn't figure out how to ask her and get her to understand the question, which was bizarre because it's not a hard question. And it's not a hard, charade to figure out. But this guy just could not figure out how to ask this woman this question, but he's doing it in the waiting room. And everybody else who's in the waiting room waiting for their turn to be prodded can hear what's going on and that she can't understand. I'm thinking, I really want to jump in and help, but I don't even know what language this woman speaks, but I still could have figured that out. And eventually, by the time she figured it out, and she was highly amused by the question and just told him, no baby inside. I think she said, no baby inside, and pointed. People could smile, but we shouldn't have had access to that. Right. And there wasn't respect for her privacy. And imagine how scary it is that she's doing medical evaluations where this person didn't request a translator in a city, this is specifically in Toronto, where there are more than 30 languages recognized in the public school system. My daughter's schooling was not in English, K through 12, she was in French. So it was just very interesting and shocking because I'd never experienced anything like that in the States because there was no reason to do so.
Yeah. Well, in the States, the naturalization process, right? It's quite a interesting process for folks that don't know that attempt to become U.S. citizens. You have to take a test. It's a history test. They give you a book, study the Constitution, and you have to know specific government questions. And as an adult taking that test, I was like, why did I wait so long? That's a whole nother story for another day. But it's definitely a really, I'm going to just say interesting, because there's so many things that you don't know are going to happen and things that you're signing off on. And depending on what country you've immigrated from, you may or may not be able to have dual citizenship. I wasn't able to, but I think you, Dr. Rush-Wilson, were. So, but I couldn't maintain my citizenship. But the one thing I just want to share with folks, that is a very taxing process for many persons. Obtaining a status in this country, it was much easier back when we came, but it's much more difficult for people to be sponsored. And that's the terminology to find out if someone will sponsor you to come to the US, in particular, my country. And I think it's important for counseling students to know the stress of that, because it's very expensive on top of that. And it can be a very, very long process for many people. So
yes. And also think about this. There can be the reasons for immigrating are different. I didn't immigrate from the United States with an E and become an immigrant in Canada with an I because I hated my country, because I was chased out, because there was war and strife, because of anything like that. We did it by choice. We did it because he went to college in Canada. She was in school in Canada. We'd been there for such a long time. There was no purpose. And since we had no plans to return permanently, to not completely experience Canada. We know other people who have come into Canada for very, very different reasons, who don't have the option and the luxury to get in the car and drive 4 hours and 15 minutes and be back home around family. They can't go back. There are things in their country of origin that are so challenging, so tragic, so profound that they don't have the option to return. For some people, the distance is too great to go back regularly. There are many, many reasons and factors to consider when you're working with somebody, but at core, they all are in a new place.
Exactly. You want to be sensitive to the unique situations. And I think we'll get into it more when we talk about these situations in our conversation today, but they're very unique, and these factors are determined by history. They're determined by the current sociopolitical climate, lots of things that can impact a person and their stress level. So
Yes.
yeah.
And they're big.
They are big. We came here for a better opportunity. My country happened to be a socialistic country at the time. And during those years, there was a huge influx of people from what was former Yugoslavia. The doors opened. People were permitted to come in. But now if you don't have a reason to be here, family, it's very difficult. As US citizens, we're pretty much free to travel wherever, right? But now it can be quite challenging for many persons outside of COVID to be able to get a visa to come and visit.
Yes.
And so think about the immigrants that you do counsel. They could really be out there by themselves for extended periods of time, because one, it's not affordable. Two, it's not possible. So yeah, for sure.
It's very interesting because living in Toronto, there is a ton of diversity in that city. There are lots and lots of people who were not born in Canada. In fact, my neighbors on either side aren't Canadian born. So it's really interesting to have that connection. We do know a person, a friend of a friend has I'll be careful how I say this, has a friend who is from outside of Canada. And they came on a student visa many, many years ago. Okay. But when that status expired, they didn't renew it, and they just started to get jobs under the table. At least this is what this friend has told me about this other person. And that person lives a life where they are constantly in a state of anxiety, hoping that they aren't caught so that they aren't deported back to the place that they're from. That anxiety colors every piece of this person's existence. If they happen to be out and a cop is walking down the street, they are wondering, are they here to get me? And that while that's unlikely that the police are just out there looking for this person who's not committed any other crime, there's still a level of anxiety. I understand how stressful this person describes it as being. And we have to be aware of that. This person doesn't want to return to their nation of origin. They want to be where they are. They've started a new life. They have friends, they have relationships, they have connections, they have a whole life. Now in Canada, they don't want to return. It's very similar to what goes on here in the States.
But in that, think about that individual person who is here undocumented, essentially. There's no driver's license.
No.
Medical care is a risk. Many tasks that we don't necessarily always think about. Even coming to see us, that's a risk. It's a huge risk, because are you a safe person or an unsafe person? And I think that's really important to think about those things too.
Yeah.
So yeah.
Because how can even that one, it was one weekend essentially that I was undocumented, well, sort of undocumented in Canada. She let me in on my US passport, so I was a visitor. But that one weekend was actually really stressful. And I knew we'd filed paperwork, just our dates were a little bit off. So I knew I would have to wait till that following Monday to have stuff in order. That was stressful, and that was benign compared to what other people experience. At worst, Canada would have kicked me out and I had to go back to the US, where I was going on the weekends anyway. My parents are here. And there were some health concerns and issues I needed to check on with them. And I had clients here. I can't imagine how difficult that must be otherwise.
I agree. I completely agree.
Discrimination is another issue. It's a very diverse city, and my child is an athlete. And in the parent waiting area, there was this one guy who had immigrated from Greece specifically. And he was just going on and on and on about this other family who had immigrated from a different country, actually a whole different continent from him. And he had a whole lot to say about those people and how when they immigrate here and they do this and they do that. I'm thinking, but you immigrated here too. This is the same thing for you, but one was a visible minority and one was not so much. So this person had a lot to say about those people. And this was something, he's, from what he said, this was not an uncommon sentiment in his family. So this wasn't just something he made up by himself. But issues like that, where your neighbor may have some really pointed feelings about you, further creates a level of stress when you are very, very far away, not only from your family, but from your customs, from your quotidian life, from things that are normal for you.
I completely agree. Completely agree.
Can you talk about your research?
Sure. I just want to share with folks just a little bit about some of the major issues you should think about when working with immigrants, and kind of do more of an overview, because this is a topic that you have to be really intentional about researching. So as you listen to this, think about your own process and think about what that process would look like on making sure that you're comfortable doing it, but what are the steps you need to do to educate yourself on the particular issues that many immigrants face. So some of these things, Dr. Rush Wilson and I will just, talk about and share. It's the beginning of something. If this is something you want to do, you have to understand that it's much more than what we're sharing today that requires, you're required to do. The first thing you need to think about when you decide to work with an immigrant, especially if you're working in college settings, because that's oftentimes where students will have their first maybe counseling session with a student that has come over to obtain education. You want to think about language. How much, just because the person is here, okay, and they can speak a little bit of the language, how much do they fully understand? We don't think about it, especially when the person is speaking back to us, right? And that individual may understand the English language as they were taught in class, but not the jargon that we use, not the little nuanced ways we talk about issues. They may be very literal interpretation. So you have to think about how you use language. Yes. That's a really important assessment point. And that's oftentimes when I do, and I think all counselors should, is offer the opportunity to have a translator there. Now you got to think about how comfortable you are working with translators. Is that something you can do? Can you conduct a session with the translator? Because sometimes when you're trying to convey certain things, again, a literal interpretation of what you're trying to convey doesn't always convey appropriately. So I think it's critical. I really, really do think it's critical for you to think about language. I didn't know if you wanted to say something else to that.
Well, even if, like you said, you think about how you use language. When I think about when I have to function in a different language, and I'm very careful because I'm thinking about what I'm saying, just to really hope I'm not making some kind of even pronunciation mistake.
Sure.
I was talking about being, when I was a kid, and it's an exchange student essentially in a family in France. That was a weird experience because I was living only in the States. I'm living in a kind of low SES area. My parents had to go to the bank to take out a loan it was just $1,200 at the time. This is way before some things changed for my family's SES. And to be in this family and to have this experience where I'm functioning on 5th grade French was interesting. And I remember telling my French sister, her name is Anne, but it would be Anne in English. And said, "Je suis saoul" is what I said to her. And she laughed and she was telling me that I essentially told her I was drunk. Je suis saoul and je suis seul are very different, but they sound alike, especially when you're
sure.
10. My Spanish teacher, maybe a year or two ago, told me that she went into a restaurant and she said, "I'd like to order a bear." And people were acting like they didn't understand what she's saying. Really? Because I do. But I speak more than one language. So if somebody said something that seems weird, I want a bear. But there's alcohol being served, I'm going to assume this person is ordering a beer, which is what she was ordering. So there are times when people aren't, especially people who perhaps don't have fluency or familiarity with more than one language, don't realize how, if you are a little more flexible with what's going on and pay attention to how much effort and how much intelligence it takes to maneuver in more than one language, perhaps people could be a little more patient.
Yeah,
Would you say?
absolutely. I mean, absolutely. I mean, we're both fluent in multiple languages, so
Mhm.
we understand and are sensitive to the issues one may run into. But if you're not, and these will be your first, sessions,
Mhm.
you really have to try to have a full understanding of the comfort level of the client and your comfort level to be able to explain appropriately.
Yes.
Um, the next thing I encourage persons to do is assess the level of acculturation.
Mhm.
You need to assess an acculturation. I don't know if you want to start talking about it now,
Think
but we
about
can,
Barry, sure.
yeah. I mean, you want to know a few things. Has this person immigrated to this country by choice, or are they a refugee? That's really important. And because that will also have implications about how acculturated the person is, how
Mhm.
assimilated they are, and how they're currently existing within the context of this culture. Um, so knowing that person's level of acculturation is critical because it gives you information as to how you can better relay information back to the client.
Mhm.
Um, Not being exposed to the culture in which we reside in, uh, you're going to make assumptions. You don't want to make those assumptions. So, a lot of my research is focused on looking at separated populations. Separation is a type of acculturation. Separated populations are persons, they're ethnic enclaves, communities that choose to live and reside in the US for the purposes of this conversation, but retain the majority of their culture. They exist within this society,
Mhm.
but they retain their culture, which means they speak their language, eat their own food.
Mhm.
The associations tend to be of people that are ethnically the same. And there's quite a few communities in the United States, and especially in Canada, the Toronto area. You see this quite a bit. I mean,
Mhm.
you want to know that. So to have a person come to you, being a part of a separated a population has tremendous implications. They're taking a risk because they're stepping outside of their community for support. And then you can look and see if someone, or you try to assess and see if that person is also assimilated.
Mhm.
Assimilated doesn't give you a choice. Um, Assimilation is you need to adopt the ways of the culture in order to survive, essentially. And then you abandon your identity that you may have come here with. And we see that historically, that many immigrants that came to this country did that.
Mhm.
When I was talking about the naturalization process, they ask you, do you want to change your name? And that's an odd question to be asked at 34, I think. No, I think I'm good. But it's a question they ask all people when they get naturalized in the United States. But think when folks were coming over to Ellis Island or in the beginning, that's when people changed their names.
Mhm.
Um, so
I have a quick
go ahead.
Ellis Island story.
Sure,
I,
go
I
ahead.
was I was at Ellis Island a couple of years ago. We were at a conference in New York, and I'd never actually been over there. I'd seen the Statue of Liberty, seen it, but we actually got to go over. Had a great tour. I have a colleague whose husband is a person who does the ferry over, so it was great. But when we were there, I was with some colleagues, and a question was asked that was really interesting to me. As they were going through records looking for their ancestry, they asked, "Did I want to look for mine?" Because I didn't even budge, thinking no, the immigration process, since that's what we're talking about, was very different for me than it was for them. It was
Hmm.
just really interesting. So it once again it made me think, wow, when I'm in Canada where I am actually an immigrant, I expect to have some bumps here and there because I came to by choice that country, was
Hmm.
born here, and I don't have the same access to certain types of information as other
Hmm.
people who were born here or whose families did immigrate by choice.
Hmm.
So yeah,
Hmm.
you're right. When you're talking about if people came by refugee status or however they came, those things matter and factor into the overall experience of being here.
Absolutely. There are different types of clinical situations we end up seeing by understanding the status as to how this person ended up in this country and the reasons why they seek help. Um, so understanding the acculturative stress and process one is experiencing is really critical. So we talked about separation. We talked about assimilation. We haven't discussed what it means to be bicultural. You want to know if your client is bicultural. And in the simplest of definitions, this person chooses to live within both cultures, free to move through those cultures as they choose to, and are quite comfortable doing so. That's how I describe myself. I'm bicultural. In my home, we speak Macedonian. Why? Because the elders do not speak English. So it's very normal for me. We eat Macedonian food. We celebrate the holidays. Church is Macedonian. And then even the TV, you'll know immigrants all know the same satellite distributor to provide a lot of, connection back to one's home country. So, but then I can step outside of my culture and live within, US society, still with the same level of comfort, different issues, different concerns, but I can do that. Now that didn't happen till much later in life. So that I want to stress to you isn't something that one says, ooh, I'm going to be bicultural. It's a process. You go through this real intense process that struggles of assimilation, marginalization, and then coming out and saying, I choose to identify as bicultural because I can live within both cultures. I do not feel I need to choose one over the other, is a very difficult process. And it can be extremely difficult, especially when you're counseling clients, because there's many struggles that come out of that. They're huge. When one chooses to, say, marry outside of their own, cultural group. Think about, and if you come from a very, very ethnocentric cultural group, that can be a really intense experience for a person, not being accepted. That's just one, or wanting to change your religion is another one, because you will be shunned by your community, especially if they're separated, in the sense that we're discussing the terms today. So, I think understanding that person's level of acculturation and how they choose to discuss their acculturated experience is really, really important. Really important. So,
and I do want to briefly mention too that a lot of what we're talking about is based in part, at least, on Barry's 1992 model. Yes. And what he looked at was, I took a couple of notes just to make sure, strategies for coping. So we're talking about assimilation, about separation, about integration, and marginalization. So if you aren't familiar with those, you may want to look into Barry's 1992 work just to make sure you're familiar with those terms and what they mean.
Absolutely. Absolutely. Because there are, like I said, tremendous clinical implications in working with immigrant populations. Is there anything you wanted to add to that, Dr. Rush-Wilson?
I can talk about one client that I worked with in my internship. And it was very interesting because this was part of the reason I started taking Spanish lessons, because it was so difficult to work with this woman. And I felt like I was failing her because she had purposely chosen me to work with out of the list of providers. And my Spanish was much, much worse. It's not perfect now, but I did start taking lessons for many, many years, in part for that, and in part because the place where we both used to work was traveling to a Spanish speaking place. And I didn't want to go and not be able to communicate at all. But with this woman, it was so difficult that she started to bring in her like 8-year-old daughter. And that's when I actually felt bad, because this third grader is essentially functioning as a translator, which makes me wonder, does her mother even want her to know all of these personal things? And our practice didn't have translators. It was something that the place where I was working at the time, it hadn't even come up, despite the fact that there were lots of people who spoke different languages. We didn't have any official translation services available, so we had to work around some pieces. I'd rather struggle with you than have this baby in here, because it keeps you away from being able to be completely comfortable and honest, and it's providing her with more information than she really might need at 8 years old, so that she can develop on a childhood trajectory. I didn't want to parentify this little girl. There was no maturity issue with her mother. There was just a language barrier. So we worked together long enough for me to find her services in a place where they had fluent and native Spanish speakers so that she could get what she needed. I was flattered that she wanted to work with me, but at that point, I didn't have the skills that she needed. There weren't super complex issues, but that language barrier is significant. And while I wouldn't necessarily counsel someone in another language, I can survive in 2 other languages well enough to get you what you need.
You made me think of something when you were talking about that. That is a very common thing amongst many immigrants. I live it. As I shared with you, my parents did not speak English. Most of the elders in my family don't. Broken, but not enough to really get by if they were to seek out services. So it's a very common thing. And or they bring in another person that can translate for them. Think about the implications of, well, does this person sign off on the forms too? Or do I don't have them sign off on the forms? Is this person really telling me what's being said? I mean, things like that are definitely important to consider, but it's not uncommon. It is not uncommon. People don't come here many do, they already know the English language, but many don't, who do not choose to learn it. And no one has to learn the language. That's the thing one needs to be aware of. I think that's a bias many novice counselors may have in the beginning, where they feel like how am I going to, they should have learned the language. Why should have they? Why didn't you learn theirs? I mean, you get into this debate there, but again, I think we could have a whole hour discussion around that. I was going to jump into some other things that I think are important. Is that okay?
Yeah.
When you're working, like I said, understanding level of acculturation, that was the one thing, but also you need to have have some type of understanding about how this person you're trying to provide services to perceives your role as a counselor, but also their understanding of the counseling process. Oftentimes, in my experience, we're looked at as the expert. So the person comes in with this belief that you can fix them. I'll get fixed. I'll go talk to this person and they'll fix them, which is really it's not consistent with the way and when I say we, teach counselors the skills. It's very Western, how students are taught, and it's grounded in Western philosophies, ideologies. So you have to think about, how much am I willing to adjust to work within this client's cultural context? And you're thinking about what is ethical, what may be unethical. So not only are you potentially providing a counseling service, you need to be prepared to obtain appropriate supervision and consultation, because we all have varied opinions as clinicians. We do, right? My preference is to attempt to always work within the cultural context of the client, rather than force them to come and work within the cultural context we're all trained to do, because you're not going to get that therapeutic alliance established. And if you don't have that alliance established, then, you don't really move forward. So you having an understanding as to how they understand your role, but also understand this process, I think is absolutely critical. But in addition to that, the understanding of confidentiality is another issue, right? You have to be able to explain that appropriately, because now that is a legal issue. And it's a legal and an ethical issue. But I think it's really critical for that person that you're working with to fully understand that. And helping them to understand that also means that your paperwork, again, they can do it with the translator, or you may find yourself, and there were times where I had to have that information translated. Again, you don't think about that stuff sometimes, right? But if you're going to come into this experience and working with immigrant populations, these are some of the basic things that one needs to consider. So
yes, and translating doesn't mean you just run it through Google Translate, because that's
no.
a start.
It is.
You might figure out some things, but there can be, because it's a computer program, there can be some misses there. So you really need a set of human eyes to read through things. There was an interesting study done several years ago that I learned about at an Academy for Eating Disorders conference, where somebody took a really well-known inventory in English and they gave it to people in Spanish who were English speakers. Then they asked those English speakers who were bilingual to translate it themselves back into to Spanish and then back into English, and they got different items. So even having human translation has errors. Computer translation certainly will have errors too. So
Tremendous.
you have to make sure you're using a person who is fluent, who understands psychobabble and psycholese to translate these things, just to make sure, and legalese, to make sure that they are appropriately being translated.
Exactly. And could be understood by the client. Yeah, that's a really, really important thing to make sure that you can do. And that piece of it can be a little nerve-wracking, but you have to obtain that support. Excuse me.
Well, while you're saying that too, there's another thing that I want to make sure we cover. People who do not speak English or don't speak English fluently are not stupid people. They aren't immature people. And it's interesting sometimes for me to see how people will approach a person when there's a language barrier, especially the person with the dominant language fluency. So I've seen people do things like, do you want to eat? And I'm thinking, what is happening here?
Because they're speaking louder, right? The person isn't.
They can hear. Exactly. If there is a hearing impairment, then yes, I understand addressing the inability to hear. This person doesn't have an issue with hearing. There's a language barrier. So speaking English more slowly, okay, I can understand that. The volume is really, really interesting. I'm not really sure. I have a hypothesis. I have some thoughts around that, but that isn't really necessary, but it can also feel very condescending.
Absolutely. And just to share, someone very close to me received a diagnosis as hearing impaired for that same reason, because the nurse, it wasn't that this person did not hear, they just couldn't understand. And on the medical record, it said hearing impaired. What? Right?
Exactly. Yes.
So as we talk about this, I mean, I think you all listening out there can realize this is pretty complex. It's a very complex experience you may have with an individual who is an immigrant, and you are attempting to provide mental health services to, because there's this whole other piece that when I asked you all to consider, how does this person understand the counseling process? You also have to consider, how do they understand mental health diagnoses? Because, and to be careful not to overdiagnose, misdiagnose a client because of what they're reporting to you, because there are cultural bound syndromes that are very, very much a part of certain cultures. And if someone is expressing this to you, you don't want to, interpret that, say, oh, this is psychosis. No, this is very much consistent with that person's cultural view. I wanted to say that because that's another place that I think, folks could use more education. There's about 15 minutes left. So the other piece I did want to bring up before I forget to bring up is, which is along these lines of the cultural bound syndromes too, is how comfortable are you working with other professionals when you're counseling an immigrant client? And the reason why I say this is because oftentimes many of the referrals I've had come from ER doctors or college physicians, because a lot of times we know the symptoms of anxiety, depression, the ones that we see, I think, more often than not, are presented in somatic forms. So we need to comfortably support the client, but work with this medical professional, because that needs to be ruled out initially, right? So these are things that I think you have to be comfortable with in saying, I can work with a medical professional in supporting this person, but not completely, minimize or dismiss what that person is experiencing. Anxiety can feel like a heart attack. Yes. Okay. Depression can feel like a stomach ache. I mean, these things are real to a person, especially in a person that maybe hasn't fully been able to express their emotions or have an emotional experience that was normalized within their cultural context. So that's the one thing when I started working with a lot of college students, I had to get comfortable with working with the physician and working with the physician as the physician may have been treating them for a actual medical condition and helping that person understand the differences between the medical condition and the symptomology that's often associated with some of, like I said, depression, anxiety, homesickness, these things. But if you don't know that, you could be feeding into something too and perpetuating even more anxiety. You have to do a comprehensive assessment of the presentation of symptoms. You really do. And then work with other professionals that could be supporting that person.
Yes. And you have to do a little bit of background into what culture-bound syndromes might be affecting this person. Specifically, what are they? Do you understand what this thing is versus this thing? And there are a couple of really interesting sources you can consult to find out just what types of things are most prominently identified in different parts of the world. So the DSM is not the end all be all of mental health. There are things that show up even within the US in specific populations and different cultural groups that we don't talk about. So yes, yeah, absolutely. It's a great point. Please make sure you basically know who you're working with, understand a little bit about them.
Yeah. I worked on a crisis stabilization unit many, many years ago, and there was a young man that was brought in, and the diagnosis was quickly given to be schizophrenia. Well, the psychiatrist on call gave him that one. The psychiatrist who returned that Monday morning happened to be much more familiar with the culture, and it wasn't schizophrenia. This was a response to a death this young man had faced. And what was being witnessed by outside people was a very spiritual experience. Now, I'm not saying that this happens all the time, right? But when these things happen, they warrant some level of consideration and consultation. They really, really do. Because think about that kind of diagnosis on your medical record could really, really have strong implications for future healthcare and mental health care. So we want to be really sensitive to that. And I think you need to spend some more time educating yourself about it.
Yes, absolutely. Especially as we become, with the pandemic right now, there's not quite as much travel back and forth, but as the world opens up and we have access to the internet, even shows like 90 Day Fiance, the whole premise of this show is having people from the US culture. And it's kind of like the normative culture for the show, going to other places and, partnering with and ultimately marrying somebody from outside of the US. And that's on the Learning Channel. It's like it's entertainment for people. But these people, and from what I've been able to see online, these actually are married couples. So this person really did marry this other person. They just kind of televised it up a little bit and dramatize it a little bit, but you're getting to see some issues that might face people. This person from this culture marrying this person is a different religion and a different age outside of the marriageable age, according to this other person's parents. That might be problematic. That might be an issue that you face. Issues of religion, issues of education. I was a physician in my country. Now that I live in country B or in the US or in Canada, I'm doing this work because this is all that I'm able to do. That's scary.
And if you sit back and really think about it, what you just said, this person was a physician in their home country. They come here with 20, 25 plus years experience, and they're told that that means nothing and you have to go back to school. So could you imagine what that person is experiencing at that point?
Exactly.
There are oftentimes things that I don't necessarily know if they are taken for granted, but that is one thing you will see happening, because this person now not only has to adjust to this new world, but they are forced to abandon. There's lots of negotiation that takes place in making a decision to come and live in a new country, and the issues that you end up facing because you are now. Yeah.
There is like all kinds of medical things. So there's a physician, an actual physician who has a YouTube channel. I think he does some stuff on Instagram and other places. And he immigrated to the United States from Russia as maybe he was 5 or he was young. Had an older sister who was the one who could speak English, and like he was impressed with her. He said because she actually could talk about a specific kind of soft drink on the plane flying over and blah blah blah. His father was a physician in the country of origin, but in the US had to go back to med school and retrain. Imagine what that did to the resources of the family. Yeah. His mother had a PhD, and I don't remember the field, but they couldn't work in the fields in which they'd been working for years. They had to spend the money, the enormous amount of money it cost to go to medical school, and had to reestablish themselves in careers that they'd already had someplace else. It's totally different once they got to the US.
Yeah. And the process then, even to be denied to practice your profession in the US, you have to go through a really intense process where some professions you're permitted, ones that require licensure. I have not personally seen someone able to, move into the field unless they came or were trained in a university that was recognized.
Right.
But I haven't seen that. But that process of having your transcripts translated, your birth certificate transcript, it is timely, costly, and a lot of times you end up being denied. But I've seen, I've seen quite a few people that went through that process. They wanted to give it a chance, and unfortunately, it didn't happen for them. So.
I want to talk about really quickly too, as we get close to wrapping up, the idea of soft immigration. And I say soft immigration because when people come to whatever country from countries that have some similarity in language or culture or something like that, people might not realize the type of issues that person still faces. So for instance, our closest friends in Canada, they're a married couple. And one is from France, one is from Australia. So they speak the two languages accepted in Canada. So someone might think, well, they don't face issues because they don't have a language barrier. That's not the only thing that creates an issue. So there are issues, they're very distant from their family. The culture is very different. And sometimes when we eat dinner together, we'll talk about what this is really like. We've got 2 Americans, an Australian and a French person sitting here now living in Canada, which, there's some similarities, and we are probably as comfortable as immigrants can be. But there are still things that you go, whoa. There are times when I cross the border and I'm back in the US, and I can actually feel that there is a difference in the familiarity I have with the US versus Canada, where I've been for more than 15 years. But there's still something different about being where you're from. And when I am here, there are things I miss about being there. So there are some interesting issues that come up with even soft immigration. When I'm there, can I speak? Sure, I can speak in English, je peux parler en français, and it works either way. That doesn't alone describe the experience for me. And even when we have people who immigrate into Canada or the US who speak English well, that doesn't mean there aren't pieces and issues and circumstances that they face that still can be addressed in counseling and need to be addressed in counseling. I think those people sometimes, or people in that position, are overlooked because folks feel like because you understand what's going on, you've got that linguistic capacity here, that you're okay. And sometimes
that's one facet. It's just one facet of, I'm sorry. But that assumption happens quite often.
It does. Yeah. It really does. And things aren't necessarily okay. And that counselor you have who speaks the same language as you might not have the cultural context that you were referencing earlier to really help you address, especially if they take the culturally dominant expert role and diminish the impact and the power of the experience their client is having.
Absolutely. Absolutely. Wow. I think we just talked about many different things this afternoon. And that's why I said in the beginning, we're going to do a basic overview because as you can see, there's so much complexity to all of these issues that you may not consider. You don't have a reason to consider, because you just haven't had the opportunity to work with someone. But basic life tasks can create major obstacles for people. As you were talking about, the soft immigration piece of it, what came up for me, and I just want to share this and then Jen, because I know we have 3 minutes, but not being able to access your home food, the food that you grew up on. Can you think about what that does to a person's overall well-being? Not being able to have a market where you're accustomed, to eating certain types of food. Not being able to worship the way you were able to worship because what you worship, there's nothing in the area. Not only, are you losing your identity in many ways, or losing pieces of your identity in many ways, you are also having to become extremely resourceful at the same time in order to get those needs met. So as counselors, we don't think about that, but I had a client ask me, where's a market near here, that I can go and buy what they were looking for. It was really interesting, but I just wanted to share that final thought.
No, it reminds me, I eat seafood, and it reminds me of my 2-day quest to find a piece of catfish. And I was thinking, I am determined to find, and I couldn't for whatever reason, even in fish markets, not that it's never sold, I just couldn't find it. And it was making me really miss being home. Where in the 2 days I went around Toronto trying to find this catfish, I could have driven an hour back to the US and crossed into New York State and found some catfish. But there was just it had meaning for me. Yeah. Wow, I can't find the kind of macaroni and cheese I'm used to. I can't find some greens. I can't find these things that I just might want today. I couldn't find cornmeal. That was weird for me. I eventually did find it, but it wasn't just easy.
Sure.
I thank you so much for your time.
Oh, no, thank you. This was wonderful.
And I hope you all got something out of this. Thank you much. Stop the recording now.